Good evening. A warm welcome to our employees and their families. It's an honor to be with you this evening, and I want to give a warm welcome to the entire extended UI Healthcare family. I'm Suresh Gunasekaran. I'm the CEO of the University of Iowa Hospitals and Clinics. I want to thank you for joining us tonight. I really appreciate you taking the time, especially since it is your own personal family time. I'm also joined tonight by Dr. Terry Brennan, who is a cardiologist, a clinical professor, and also our chief medical officer. As CMO, Dr. Brennan oversees all medical operations, ensuring staff and patients are appropriately cared for. I'm also joined by Dr. Jorge Salinas, clinical assistant professor of internal medicine, infectious diseases, and our hospital epidemiologist. As an infectious disease specialist, Dr. Salinas has been our lead epidemiologist throughout the pandemic. He and his team advise us on how to reduce transmission of the illness and keep our staff safe. Tonight, we want to talk about several topics. Current COVID-19 pandemic situation in Iowa and our local communities, what to expect in the weeks ahead, what we all need to do to keep safe, and finally, we want to reserve a lot of time to take your questions. But first and most importantly, we must recognize and thank our staff members' families for the sacrifices that you have made through the many months of this pandemic and the many months ahead. The images and messages you saw at the start were submitted by employees of their family members as a way to recognize their loved ones for their support through the year. On behalf of UI Healthcare leadership, I want to extend our sincere thanks as well to our families for your patience during this COVID-19 pandemic. This pandemic has taken a lot from us personally, especially those working in healthcare. You've probably seen a lot less of your loved ones this year. And when you do, they may be exhausted, overwhelmed, or emotionally drained. I know it's not been easy, especially with all that's going on outside of work. Figuring out how your children are going to go to school, figuring out your daycare, possibly recovering from the derecho. Thank you for making the arrangements so our team is the one that always shows up. That means we've been leaning on each other a lot more this year than we've had to in the past. Know that you and your actions are appreciated by all of us. Second, I want to make sure you're aware of the incredible contributions our team members have made this year, caring for patients, the community, and the state. Through their determination, innovation, and hard work, they have created what I think is the safest place in Iowa. We continue to plan and deliver and adapt so we can continue to deliver exceptional care to our patients during extraordinarily challenging times. They, for example, keep our facilities clean, keep expanding our ability and capacity to test for COVID, flu, and respiratory illness, create new ways to successfully treat more patients at home or in the hospital with COVID, run telehealth clinics so patients can be seen from the comfort of their own home, research successful new COVID drug trials. Through it all, deliver unwavering, high-quality patient care to thousands of Iowans and others with serious health problems. That's not the complete list, but it highlights a few of the major areas. I'm immensely proud of our team's ability to be dedicated to the mission and their perseverance. I know you are too. But I do have to remind you that UIHC is really a hospital and clinic system that's really like no other in this state. We are the place that people can come to get rapid COVID testing and get the results within a day. We are the place that serves all Iowans, regardless of their ability to pay. We are the place that others call first. Other hospitals call first when they can't figure it out, and they call last when they are out of other options. We are the place that 12,000 people have committed themselves to supporting one another and every Iowan. We are the place that won't and can't give up on Iowans. So when your loved one comes home from work and looks a bit tired or distant, please know that regardless of their specific role, that they are playing a huge part in the success of UI Healthcare. Our employees continue to be there for UI Healthcare, and I assure you that we will be here for you as well. Now I'd like to turn it over to Dr. Salinas for an update on COVID-19.
Thank you, Suresh. The situation of the COVID-19 epidemic in the United States is still not optimal. We have nearly 200,000 new cases diagnosed per day. In Iowa, we diagnose nearly 4,000 new cases every single day. That has translated into nearly 1,500 patients hospitalized with COVID in Iowa. And unfortunately, that is translating in 30 to 40 new deaths per day. Here in Johnson County, we are diagnosing on average 140 new cases per day. Linn County is diagnosing nearly 340 new cases per day. There are some good news still. Iowa appears to have stopped increasing in the number of new cases. We appear to have stabilized. Iowans appear to be getting the message, appear to be following the public health recommendations that we've been providing for a long while. But 4,000 new cases per day is still a very high number that will lead to many hospitalizations in the coming weeks. So Iowans still need to get together in trying to bring the number of new infections diagnosed per day down to 3,000, 2,000, 1,000, and hopefully near zero. It can be done. It's been done in other states. It's been done in other countries. And we'll talk some more later about new developments in the vaccine and treatment front. So there is light at the end of the tunnel. If we all work together, if we start implementing the public health recommendations that our state, our federal government is providing us, and UIHC is providing to our public, we can bring the numbers down. But at the moment, the situation is still very serious. I encourage everyone to wear a mask, to do physical distancing, to not gather in groups larger than 10, especially when they include people from outside of your household, and practice hand hygiene frequently.
Thank you, Jorge. Dr. Brennan?
Thanks. Welcome this evening. I want to echo Suresh's comments and thank all of our employees and all of their families. To be a healthcare provider is a challenge at times. We sign up for this because we know that we will be faced with challenges. Most people didn't sign up for this knowing that COVID-19 would come. So our healthcare providers here, our nurses, our pharmacists, our social workers, all of our staff and faculty have been in it together. We are working tirelessly to take care of patients, and we're doing it together, and you should be very proud of your loved ones. They should also be very thankful for you. Families are really important. Families support us each and every day. I want to give a shout out to my own family. The support that we get from our families is so very important to each of us, and my family is no exception. You're a blessing to me, and I want you to stay safe. I'd like to talk about a few things. The first is that it's been a long road here, hasn't it? This pandemic has gone on way longer than any of us anticipated in the beginning, and many of us are tired of it. All of us are tired of it. With that comes what is termed pandemic fatigue, and sometimes that leads to complacency and leads to people not doing what we know in our hearts are the right things to do. In order to keep each of us safe, in order for us to get through this together and get back to something that is more like normal, it's important that each of us be empowered as individuals to do as Jorge had said, to wear your mask and wear it properly, to make sure you're distancing when you're around others, to avoid large gatherings where we know that there is a likelihood as gatherings get bigger with the prevalence in the community of this virus that you're going to encounter someone who has the virus. And then finally, to wash your hands. We can each make this decision on our own and be empowered to actually help us as Iowans and as Americans to get to the end of this. As Jorge said, there is some light at the end of this tunnel, right? We are all very excited to hear the news about the two lead candidates for the vaccine, both the Pfizer and the Moderna vaccine. they have released that they appear to be quite effective. We're still waiting on the FDA to review their safety, but once that happens, our team will also review it, and we will be offering vaccines as soon as we're able to. And I, for one, will take it. I know there's a lot of concern about the rapidity which the vaccine trials have happened, but they have studied a large number of people, a large number of diverse people from different ages and different races, lots of diversity. And so if these trials show to be effective, I will certainly take that vaccine. And I think that that's our best chance of getting back to normal. If and when that vaccine does come to pass, though, it's going to take time. We understand that priority will be given to those healthcare providers who are daily taking care of COVID patients and have the opportunity to interact with patients with COVID. And so for the vaccine to be distributed widely to the communities, it's going to take time, perhaps months. In the interim, it's really important that we continue to do what we know to be the right thing to do in order to stop the spread of this virus. So please follow those safety practices. Please don't gather. I read recently that we're not going to have Thanksgiving and Christmas this year. Well, that's crazy, right? We're going to have Thanksgiving and Christmas. We just have to have them differently. We have to make sure that we're all going to be here for the next Thanksgiving and Christmas by keeping each other safe and not gathering together with people that we don't live with, people that aren't following potentially the same safety practices that we are. So thanks again for coming tonight. Really want to make sure that you keep yourself safe, and we hope you have a great holiday season.
Thanks, Dr. Brennan. I just want to encourage everyone to drop any questions they have into the chat, and we'll get them answered here. But with that, we'll get started with some of the questions that have already been submitted. For Dr. Salinas, how long does the virus live on hard surfaces like tables, doorknobs, and countertops?
It's not very clear that the virus can survive for a long time in those surfaces. What has become very clear is that surfaces are not the main way that this virus is transmitted. The virus is predominantly transmitted through the air, either via large droplets or smaller particles called aerosols. That's why wearing masks is very, very important. It's also important to practice frequent hand hygiene, but for example, I no longer recommend people to quarantine the stuff that you buy at the grocery store or to try to wash it before coming into your home. So again, contact and surfaces are still possibly a route of transmission, but probably not the main route of transmission. Wash your hands frequently, but more importantly, wear a mask in any interaction with people from outside of your household.
Another question for Dr. Salinas. With schools opening, it seems the virus spread has gotten out of control. Is it possible that the kids mixing in school have brought the virus home with them? It seems odd that in these rural communities, the viral spread has gotten so bad. Any thoughts?
I think that any place where people congregate, there is the possibility of transmission of the virus. It's clear that COVID-19 can be transmitted in schools. However, this is perhaps not the main location where transmission occurs. Transmission appears to be occurring in locations where adults socialize, bars, restaurants, or family gatherings, weddings, etc. So the recommendation is the same for adults or children, is to maintain your distance, wear a mask, avoid being in large crowds. Now, if we're going to have large crowds, it's probably best for our society to invest that small capital that we have or that small budget of socialization to put it into education, into schools, rather than socialization for leisure. So yes, it's clear that schools can play a role in transmission, but it's probably not the main reason why the number of cases has increased in Iowa.
Thank you, Dr. Salinas. Dr. Brennan, next question. I live with my daughter and I'm on oxygen and not healthy. If she contracted the virus and had to quarantine, can we successfully do this at home?
Yeah, I think it's hard, but it's possible. I think the most important thing is for each of you to be monitoring for symptoms, and at the first sign of symptoms to get tested. Once a positive result is present, you can mask at home. You can be very vigilant about cleaning surfaces. As Jorge said, that's not the likely mode of transmission, but I wouldn't ignore it. So making sure that that person is segregating and isolating into a room of their own, using their own bathroom, and trying not to be having shared spaces. So it is possible, but as we have seen here, when people have someone in the home who has contracted the virus, the potential for anyone else in the home to become positive is high. But again, monitor for symptoms, and first sight of symptoms, get tested and start using those safety standards at home like you would use out in the community.
Thank you. Dr. Salinas, will there be a COVID-20 virus?
No, it won't be called COVID-20. The year 2020 is almost over. But it is true that pandemics will continue occurring in the future. Hopefully there will be a number of years or decades before another pandemic of this magnitude. But it is possible. We have to be prepared. Our societies have to invest in public health. We need to learn these common practices of hand hygiene, wearing a mask, etc. They're going to help us. They actually will help us during respiratory viral season, during flu season. So it is possible that this flu season, if all Americans follow these public health recommendations, it's possible that this flu season will be milder than the previous one, and that we will save many lives by following these practices.
Thank you. Dr. Brennan, I have heard some people wonder if they should immediately bag their clothes and head to the shower when getting home from work. Is this necessary?
Yeah, necessary, I don't know, but it's not a bad practice when you work at a hospital, whether we're in a pandemic or not, to change your clothes when you get home and to wash them as soon as you can. I don't know, as Jorge said, I don't know of any cases where the clothes have brought it into the house and have caused people to transmit the virus. But it's overall a good practice to change your clothes when you come from a hospital setting.
Thanks. Dr. Salinas, do we have any idea when the vaccine may be available for the public at UIHC?
That is not totally clear to me. We are on a very accelerated schedule. Pfizer announced today that they have completed their clinical trial. There are still a number of regulatory steps to ensure that that the results of this trial are valid, that the safety and efficacy is confirmed by other scientists. So it's possible that in the next month or so, we will have more news, perhaps an approval by the Food and Drug Administration, the FDA. But from there is yet another step. A group within the CDC called the Advisory Committee on Immunization Practices, or ACIP, will review the results of this trial. This is an independent group of researchers that will assess the claims of efficacy and safety. And if that other level is passed, then recommendations will be made about when the public can have the vaccine. So it's possible that all of this will happen in the next few months, perhaps, and just perhaps in the next quarter, people will be able to get vaccinated. But again, we need to wait for these steps to be completed.
Thank you. Dr. Brennan, with the vaccine being expedited, what validation steps have been shortened or removed? Specifically, long-term effects of the vaccine. I'm not questioning the vaccine, just curious what the validation process in time of great need such as COVID.
Yeah, I mean, researchers have a long history of looking at vaccines. As a matter of fact, every year the influenza vaccine is evaluated for its safety and efficacy. So these researchers know how to conduct a vaccine trial. For COVID-19, the need for us to get a vaccine was far greater than for other vaccines that have come to pass. And so the time that people were followed after getting their second dose, if it's Moderna or Pfizer, or first dose if it's other vaccines, has been shortened a bit. We do know that most people who get a complication or a side effect from the vaccine get it very early. But the long-term effects of the vaccine won't be known for a long time. We also know that the long-term effects of COVID weren't known early either. And so one has to balance the safety of one versus the other. The good news is that the number of people that participated in these trials was far, far greater than the average vaccine trial. And so we believe that even though it's accelerated, that we will see good safety endpoints that will show us whether this vaccine is safe, and we'll know if it's efficacious.
Along those same lines, Dr. Brennan, are our teams going to review all data from the potential vaccines and then decide which one is best, or will it be the first one that is available?
Yeah, we'll review data from all the vaccine trials and look at what's available, but I think that we'll roll out the first vaccine that's available, that's safe, and that's efficacious. And then ultimately we'll add to that vaccine as others become available. Really important that we get people vaccinated.
Dr. Salinas, it is believed that once a person tests positive for COVID, they have antibodies present for around 90 days. Can they still be an asymptomatic carrier during that 90 days and infect others?
No. Virtually everyone that gets COVID recovers within 10 to 20 days. It's virtually impossible for somebody to continue being infectious for months. So no, that's not true. And in fact, we're learning more about for how long immunity lasts, and it's probably much more than 90 days. It may be 6 months, it may be a year. The amount of immunity that people get from either an infection or possibly from a vaccine.
Thank you. Dr. Salinas, another question. I've heard of a few people who've had confirmed COVID 2 times. What is the likelihood that all patients will get it twice? And can you tell us any more information on these patients?
Yes, so this seems to be a very rare occurrence. And there has been a few dozen cases reported in the world, while we've had millions of infections. So it's exceedingly rare. It can happen, perhaps in people that have defects in their immune system. With vaccines around the corner, it's very possible that we will virtually eliminate the possibility of people getting COVID more than once during this go-around. It is possible that this infection will remain in the world for years to come. So it may be possible years down the road that somebody may get infected more than once. But if you've had COVID, it's probably not likely that you're going to get COVID again in the next few weeks.
Thank you. Before we do more questions, I do want to re-emphasize again a theme for tonight that Dr. Brennan brought up in her comments, and maybe ask both Dr. Salinas and Dr. Brennan to kind of comment on this, is that we are thinking very deeply about how our extended UI healthcare family spends the holidays. And I think that one of our key messages this week and even this season is to plan ahead and think ahead about how you are going to handle the holidays. To put it simply, we think it has to be different this year for the entire UI healthcare family. I know from a frontline standpoint that multiple times during this pandemic, it's been really hard on our staff that have had to come into work because they've had colleagues that are out. And when we look at why they were out, most often, one of the common occurrences is either they or someone that they live with has been socializing, potentially definitely in a congregate setting, quite often indoors, quite often around food and drink, and this was even outside of the holiday season. And what this meant was there's so much more work to be done here at work, at the hospital, and so I think that one of the things that we really want you to consider as a family is how you could make some different decisions this year. And I don't know, Dr. Brennan or Dr. Salinas, you want to comment on that?
Sure, I can start, and then Jorge can jump in. So I think it brings up a couple of issues, right? First, you making the decision that this is the right thing to do. We all want to get together with the people we love, but perhaps that's a springtime or a summertime thing that we do next year rather than doing it now, just because of the risk. The risk with the prevalence in the community is very high. I think the other thing after you've made that decision is, how do you communicate it? How do you talk to your family about it? And the first thing I would start with is using data. So Jorge gave us a lot of data when we started about what's going on with the virus in Iowa or in Johnson County where we live. The other thing is to be really cognizant of the fact that this is a really emotional concept. This is an emotional topic, and it's really important that whatever conversation you have to do it with kindness and empathy, and really make your loved ones know that you don't want to not be with them, but you want to make sure that they remain safe, and so therefore you have to not be with them this year. I've often said maybe now's the time to start a new tradition. Right? So a Zoom tradition or something that is different that you can do separately, but maybe in the coming years will be something that you can look back on and say that's something we should continue. My family routinely does cookie making. We would get together, all of us together as a group, and routinely someone would be absent. With Zoom, we could each do it in our own kitchens, and we could all be together, at least by Zoom. So think about a new tradition. Think about how you can really be thankful. 2020 has been a really hard and tough year, but there are things to be thankful for. And how can you be thankful together while not being in the same physical location? Jorge?
Yes, I totally agree. I've shared some numbers in the past. I can share some now. I just did a very quick Google search for the Georgia Tech meeting planning tool. And it tells me that in a meeting of 25 people in Johnson County, the probability that one person will have COVID there is 70%. The same probability, the probability of encountering one person with COVID in a meeting of 25 individuals is 90% in Lane County at the moment. So this is the type of data that leads us to recommend not to gather in groups of larger than 10 people, not to gather with people that don't live with you. So that's what we have to do at the moment, that the number of new cases is very high in Iowa. If we do our homework, if we are able to bring those numbers down to a more reasonable number, 3,000, 2,000, 1,000, we can start relaxing again. But at the moment, this is what we have to do. Limit the number of people that you socialize with to only 10, and ideally only people in your household. If you're going to socialize, try to do it outdoors. But if it's indoors, wear a mask. Maintain your distance, wash your hands.
Thank you, Dr. Salinas. I think this is really a point of emphasis for us. For me, that's the take-home point, is that when you bring 25 people into an indoor setting, you have really increased the probability. And I think that that's something that you have to look at. But I think rules to live by is, even if this is going to happen with smaller groups in an indoor setting as the weather changes, the mask and distancing are going to be really, really important. Now to get back to some of your questions. Governor Reynolds stated that media reports saying that Iowa hospitals are overwhelmed are absolutely not true. What is your response to that? I don't know what statements she's made over what period of time, but I would say that overall, where we are today is that our hospital systems as a whole in Iowa are not yet overwhelmed, but they're very much at risk. I think individual hospitals throughout this pandemic have absolutely been overwhelmed, and there has been a tremendous amount of cooperation between hospitals to make sure that even if one hospital is in dire straits, that other hospitals regionally can chip in and help with that volume. But what's really, really different, and this is what the governor did say most recently in her press conference, is that she is very, very concerned about the hospitalization rate in Iowa. That the overall hospitalization rate across the entire state is at unprecedented levels. We have not seen Iowa hospitals this full in a really long time. And more troubling is that a quarter of the hospitalizations have COVID patients. So these are very, very stark data, and the governor acknowledged them directly. So I think that when we talk about the overall healthcare system, this is a really vulnerable time. And I've said this once, I'll say it many times. It's not even today and this week that I'm so worried about. We know that we have beds today at the University of Iowa hospitals and clinics. We know that. But what we really don't know is, what is next week going to bring, or what is next month going to bring? And all of that we know is based on the behavior of Johnson County and the behavior of Iowa this week. This week's activities are what lead to or prevent next week's infections or next week's hospitalizations. And so we still have the power to really flatten the curve, and I'm optimistic that we can do it. Dr. Brennan, why don't all clinics have N95 masks?
Yeah, it's a good question. Just as a review, there are multiple kinds of masks. Many people wear cloth masks because they're easily accessible, they can be homemade. We are all wearing medical grade masks, which is what we normally wear in the hospital. And then there's N95s, which are really respirators. So they have a tight seal. They're the best at keeping particles from leaving the person or coming into the person. So N95s are, we don't think are necessary actually for taking care of the standard patient, for the patient you see in a clinic. Even for patients who have COVID-19, we have had great success with our staff being able to care for these patients while wearing a shield, a gown, gloves, and a standard medical grade mask. There are times when N95s are absolutely necessary. Jorge talked a little bit earlier about aerosols, that the virus can be contained in aerosols, droplets that come out of one's mouth or one's nose. And there are times when our patients have procedures that generate those aerosols, and those are the times when those N95s are essential. So our practice is not to use an N95 unless you're in one of those aerosol generating procedures. And we've had very good outcomes with our faculty and staff being safe, using the safety protocols that we've implemented at the guidance of our hospital epidemiologist.
Thank you. I'm going to skip around on the questions. Dr. Salinas, if a family unit has gone through COVID a month ago, is it safe to visit their household? Or is it possible for the adults or kids to harbor the virus from exposure?
Yes. Well, whenever a household or somebody in a household gets sick, there's no guarantee that everybody in that household got it at the same time. So there is always the chance that one of them didn't get it at that time and now may carry it. So just for simplicity's sake, you should always assume that any person that you're going to interact with may have it, and you should wear a mask. Even if you've recovered from COVID, it's a good idea for you to wear a mask. If anything, you are exemplifying, you're teaching others what they should be doing at the same time to avoid getting it. So don't feel that because a family or a household has already got it, they're immune and it's completely safe to go visit them. You should follow the same precautions no matter who you're talking to.
Thank you. Is there anyone speaking with the university about stopping football and tailgating? I live close to UIHC and have seen tailgating for each home game. The university is aware of activities on tailgating and is continuing to monitor the situation and crack down on that. There has also been new guidelines from the governor's standpoint around gatherings in general. So I think that there will be a renewed focus on this. In terms of stopping football, I think that maybe Penn State wants us not to play football right now, but other than that, we're full speed ahead. Terry, I saw a news feed from Washington County Hospital about patient transfers to UIHC for their sicker patients. They also mentioned hospitals are transferring less sick patients to their facility. Is UIHC doing this?
Yeah, we've been working with all the hospitals in the area so that we can actually work together to be able to take care of the patients in the places that they need. Washington County has been a great partner with us, and they transfer patients to us who need us on a routine basis. We have explored the option of sending patients who are from that community or have ties to that community back to Washington County to continue their recovery when their need for our care has been completed. So we're quite pleased and grateful to have a partner like this in the community, and we think it's actually very good care for our patients.
Thank you. Dr. Salinas, what is an epidemiologist?
An epidemiologist is somebody that studies trends in diseases, studies the patterns of disease, studies how many people get an infection or any type of disease, and what are the risk factors for acquiring that disease, studies how people do after they get that disease. So it's somebody that tracks data about diseases. At the same time, here at UIHC, our epidemiologists not only track data, but we also implement measures to try to prevent infections for our patients, our healthcare workers, and for our visitors.
Thank you. Do you plan to pull staff with ICU experience from other facilities to work the floor? I'm not sure specifically. I think that if we're talking about other facilities, meaning non-UIHC facilities, it's highly unlikely. Most healthcare organizations in the state are pretty taxed for resources. If we're talking about within UIHC, yes, we have already started evaluating staff who have relevant skills and experience who could contribute to the increased ICU activities we have, but also other activities as a result of the growing pandemic. So yes, we are doing that, and we already started doing that in the last couple of weeks, and it comes as no surprise, but the UI healthcare staff have risen to the challenge, and we've seen so many people already make so many contributions. Shout out to all of those involved and relocated in the phase 1 surge. The overwhelming response has been positive, and that people are eager to help. Lots of volunteers noted. This is absolutely true, and we're really grateful for all this activity. We've had a couple of hundred people reassigned as the pandemic has progressed. I think it's one really important point to talk about, though. As you hear more and more that UIHC is surging and that we're creating more bed capacity and we're reassigning staff, please know that we're not overwhelmed. We're certainly under stress. We're certainly having to make modifications. But I want you to know, and I want the community to know, that we do have it under control right now at UIHC. These are all plans that we came up with months ago. We had over 1,000 staff in the summer go through cross-training. There's been a lot of validation. We're not putting people into unplanned space. All of this space has been reviewed by our epidemiology team, our facilities team. We've had time to plan for this and do this. It's another part of what makes UIHC special. I'll be honest with you, not every hospital in the state would have the capability to do what we do. And the reason we have that ability is we've got great resources in the form of space and equipment, but our most valuable resource is the amazing staff that we have. Between the world-class faculty we have, the amazing nursing and clinical staff, and all of the various different support services, we have a human resource that many other healthcare systems don't. So it's absolutely true that we are surging. It's absolutely true that we're adding ICU beds. It's absolutely true that we're reassigning staff, but we are not out of control. Quite the opposite. We are in control, and we are glad that we're able to continue to deliver the care that our patients need. Shout out to the MICU for consistently rolling with tight staffing and very high acuity and cross-training many individuals so we can successfully open 10 new ICU beds next week. The MICU team has always been quick to embrace change, and I couldn't be prouder of how my colleagues have stepped up every step of this pandemic. Absolutely.
Woo-hoo.
And it's been a really long pandemic for the medical ICU. And so we really do want to thank them. Excuse me.
Bless you.
Next question for Dr. Brennan. Thank you for providing shields and medical masks for those of us working with patients. It feels safe to have the right PPE. How are we doing in comparison to other hospitals, i.e. percent of staff who have gotten sick?
I can't tell you what other hospitals have had with respect to the percent of staff, but we have had a fairly low number of people who have gotten sick. I think the PPE that we've been using from the beginning, the implementation of shields plus masks has been a very valuable investment, a very valuable protocol for us to follow. And when we look at those of our employees who have gotten sick, who have gotten COVID-19, the vast majority of them have gotten it outside the hospital from the community or from people in their homes bringing it in. So we feel like that they are following the guidelines that they need to follow to be safe, and that those guidelines work.
Dr. Salinas, how long can the virus be shed in the air after they have tested positive? Also, how long can someone test positive following recovery?
Sure. So one of the reasons why this virus has been so successful in spreading throughout the world is the fact that people can be infectious a couple of days before you even have any symptoms. People remain infectious for a few days after the onset of symptoms, but probably most of the transmission occurs 2 days before the onset of symptoms and up to 5 days after the onset of symptoms. By day 10, after the onset of symptoms, most people are no longer infectious. There are some rare exceptions, but the rule is about 10 days for almost everyone. Interestingly, we have now fantastic technology, and we can use PCR testing or nucleic acid amplification testing that searches for very tiny particles of the virus that can remain present in our respiratory system, sometimes for months. It doesn't mean that you have a complete virus within your respiratory system for months or that you're infectious for months. It's just a result of how sensitive our tests can be. But rest assured that even if you test positive several weeks after your initial infection, most people stop being infectious after 10 days from the onset of symptoms.
Thank you. Next question. Why is Governor Reynolds saying it is okay to not wear a mask inside a business for 15 minutes? Isn't this sending the wrong message across our state? We want people to wear masks indoors at all times. And why is she saying it's okay for 15 minutes inside of any business or store or restaurant running in and out? I'm not really familiar with what she has said. I think this question, however, is referencing the proclamation. And I think within the proclamation that was issued just a few nights ago, there was reference to enforcement is going to be based on wearing a mask in an indoor setting for when you can't distance. But the real point of this is I think everyone, including the governor, has been consistent that you need to mask up if you can't socially distance. So I think that this issue has been very, very politicized in terms of what the regulations are and how they're going to be enforced. And over time, we know that there have been differences in Iowa. But I would like to remind everyone that the message is still the message, which is absolutely mask up, absolutely socially distance, absolutely practice hand hygiene. And this season, really, let's focus on not congregating in an indoor setting. Let's think about the holidays differently. Dr. Brennan, related, why do people not wear masks? It seems so obvious that they should, but yet so many do not.
Yeah, it's a good question, and I guess I'd have to be a good mind reader to know exactly. I can tell you that I do know people who are resistant to wearing masks, and I think the things that they point out is that there's not randomized controlled data that is very easy for them to find that says that masks are effective, though there are multiple studies, many studies showing that masks have a positive effect on the transmission of this virus and other viruses. I think the other thing that, we live in a land where people are free to make their own decisions. And I think some people are resistant to having someone take that away from them and not let them be able to make their own decisions. I would offer that by wearing a mask, you actually have freedom, right? If you wear your mask, you can actually go out of your home. If you don't wear your mask, then the safest place, the only safe place for you is to stay in your home. The concern about taking away your freedom is certainly a double-edged sword. Beyond that, I'm not sure. But I think we all can be good examples. We can be role models, particularly if you're a healthcare provider, right? If you're seen not wearing your mask, then that tells people that it's okay. And we don't want people to think it's okay, because it's not. And so be a role model. Also talk to people. Ask them, why are you resistant to wearing a mask? And tell them the data that you've heard here tonight from Jorge. There's all sorts of data on websites that are very legitimate that you can talk to them about. Encourage people to wear their mask. That is the primary way we're going to get out of this situation we're in.
Next question. Do you foresee layoffs in the future? No, I really don't. I think that we have asked UI healthcare workers to make so many sacrifices this year, including requirement to do unpaid days or give back vacation time, and all of that we think in balance, plus all the hard work and dedication around the volumes and other things, I think we're in a pretty good place. You can never say never, but we decided this past summer that we'd look at other kinds of cost reduction methods and really just take layoffs off the table, and I'd like to keep them off the table. Dr. Salinas, what length of time is one mask safe to wear? When should you change your mask?
Sure. Ideally, you should exchange it every day. Wash it. Most people are wearing cloth masks, so they're so cheap that you probably should have more than one, and just cycle them. Yeah, wash them daily, and one day.
Dr. Brennan, what is required for most effective mask wearing, type and placement of mask?
Yeah, good point. You want your mask to fit, so it should go up onto the bridge of your nose. Ideally, have something within the mask itself that can allow you to mold it to your nose so you get a better fit. You want it to fit nicely on your cheeks, and you want it to come down below your chin. The goal of it is to create somewhat of a fitted barrier so that whatever you're breathing is isolated from whatever air is outside. Most important, not to let your masks fall below your nose. That is completely inadequate. And whether it ties or whether it loops around your ears, really the big thing is about fit. Do you have any other comments?
All right, I'll give Jorge this one. In your technical opinion, can a motorcycle-style helmet be worn instead of a mask?
No.
Thank you. Dr. Brennan, my husband is currently isolating with COVID. When he's ready to come out of isolation, what steps should we take to disinfect the space he's been using?
Really good question. Bedding should be washed in hot water, as hot as you can, as the bedding can stand. You should wipe down all surfaces with an antibacterial solution. He hopefully is washing his hands. Even though he's isolated, hopefully he's either washing his hands or using hand hygiene gel to decrease the potential virus that is there. Trying to touch all surfaces and making sure that you clean all surfaces as good as possible. And most importantly, when you do that, you should be wearing your mask and hopefully wearing a pair of gloves that you can discard. Do you have any comments?
No, I would just say that, yes, I agree with all those recommendations, but in general, this virus is very sensitive to all the normal disinfectants we have at home, and putting our clothes into the washing machine will take care of it. So that's a good thing about the virus. It's relatively wimpy, so just cleaning it with the products that you use in your household and the washing machine will be enough to kill it.
You heard it here. It's wimpy. Thank you for hosting this. It is so helpful. Well, good to hear. Can you, Dr. Salinas, can you explain the 14-day quarantine after an exposure? It's hard for non-medical people to understand why you need to quarantine for 14 days if you continue not to develop symptoms. And if you do develop symptoms, would you need to restart your 14-day quarantine?
Sure. Again, we know that this wimpy virus, it's also tricky. And some people develop the infection very soon after the last contact to an infectious person. It can be from 2 days, 3 days, 4 days. Most people develop symptoms, develop the illness about a week, within 5 to 7 days after the exposure. However, there are still a small proportion of people that can continue becoming symptomatic on days 8, 10, 11. So that's why the CDC recommends 14 days to be extra safe, extra cautious that you're not going to get infected after an exposure.
Thank you. Dr. Brennan, what will need to happen before the public can begin relaxing the safety measures now recommended?
Yeah, we need to see the transmission of the virus go down a lot. I would also say that we need to have a successful vaccine and get a majority of people vaccinated. Then we can start to let down our guard and start to move toward more normalcy.
Well, it took us 48 minutes to finally get the question that I thought we would. We have the in-law question. Our in-laws are planning to come here from a different state in a relatively safe way. Car travel, staying outdoors when together, staying overnight at a different location, no sharing food. How risky is traveling right now if we do everything we can to be safe while they are here? I will let Dr. Brennan answer this, but I will go ahead and authorize that you can always say no to your in-laws and use pandemic rules if that's what you're looking for. But if you're looking for the real answer, Dr. Brennan?
Yeah, I mean, I hope you have a great relationship with your in-laws and can have really frank conversations, right? Because their safety is really dependent on how safe they practice, right? Do they wear their mask when they're traveling, as they're going into perhaps hotels or gas stations? And sometimes people are reluctant to actually tell you that, yeah, I don't wear my mask, all the time. So the safety really depends on how good people are following those practices. And sometimes that's not an easy conversation to have, but you should have that conversation in order for everyone to be safe. And they should ask you as well.
I'm going to skip around a little here. There are a few shout outs that I wanted to make sure to get out to. Shout out to the University of Iowa Air Care team. They transport those who are very sick and do it day in and day out. Absolutely. I've heard them in action during this meeting as well. A very loud shout out to the PAC, the Patient Access Center. They have done an amazing job at expanding patient access during this trying time. Despite huge call volumes exceeding expectation, every phone call is answered, patient visits scheduled, and testing arranged. The PAC has done an outstanding job. These guys have really been the backbone of our COVID response. If people can't call in and get in for an appointment, we wouldn't be able to do this. And so these really are some silent heroes behind the scenes, and we really do appreciate everything that they've been able to do. Dr. Salinas, what is the most common first symptom?
Yeah, that's another very tricky question. And the symptoms encompass fever, cough, shortness of breath, sore throat. Some people, the first thing that they feel is a problem with their smell. They cannot smell foods or they don't taste food. But depending on your age, the symptoms may be different. Some people have gastrointestinal symptoms, abdominal pain, diarrhea, headaches. It varies tremendously. So when the incidence of COVID is very high in the community, almost any symptom can be COVID. So especially if you've been exposed or you've been around somebody that is known to be sick, it may be a good idea to give your doctor a call.
Another question, Dr. Salinas. Can you get COVID through the air?
Yes, especially in crowded indoor gatherings. The more people are breathing the same air in an indoor location, the more likely it is for the virus to travel through the air. And in those instances, in crowded indoor spaces, even if you're 7 feet away, that may not be enough. So that's why our recommendation is, number one, limit the number of people that you are around with in an indoor location. Second, wear a mask. Then try to maintain your distance. And lastly, wash your hands.
Thank you. Dr. Brennan, do adults or kids do better if contracting COVID?
Yeah, I mean, we really believe that children do better. And adults of more advancing age and those that have what we call comorbidities, which are things like diabetes, high blood pressure, obesity, those are the people that tend to do worse when they get COVID-19.
Dr. Salinas, is the current strain of COVID in the area currently different than the strain we saw last spring? If so, is this strain more contagious or dangerous than the strain last spring?
I would say it's the same type of virus that is circulating.
Dr. Brennan, so if you've had COVID, you don't need to be vaccinated?
We don't know that for sure. What we do know is that trials actually evaluated whether someone had COVID recently before they were able to be enrolled in the trial. As Dr. Salinas said, we don't know how long immunity lasts. So if you are someone who had COVID-19 in April, you should have a conversation with your doctor about whether the vaccine is right for you or not.
Dr. Salinas, how do you know if the success of the vaccine is from the vaccine or people wearing masks?
Well, excellent question. So that's why we do blinded, randomized controlled trials. So when you do that type of, when you implement that type of methodology, you ensure that many of these factors, such as compliance with mask wearing, is evenly distributed in both groups, the group that receives the vaccine and the group that receives placebo. Also, the people that receive one or the other don't know what they are getting. That's why it's double blinded. And again, that assures that factor is not the reason for this stark difference in the effectiveness.
And as a part of the trial here, we know that people who were enrolled in the trial actually were told how to manage safe practices. So everybody was told to wear your mask and social distance and wash your hands, et cetera. So presumptively, the two groups would have been equal in that situation.
Next question. In your opinion, should the governor of Iowa be doing more to mitigate the virus? I'm not a political scientist. I'm not sure if the governor should do more, but I am sure of one thing. The people of Iowa should do more, and I think that we've armed them with the information necessary to do more. Dr. Salinas, is someone who's traveled and worn a mask while traveling safe to be around?
Yes. You have to be, of course, careful and follow the same recommendations, but at this point, you should assume that anyone, whether they have traveled or not, may have COVID. So if they are not wearing a mask, you probably want to maintain your distance, maybe not socialize with that person. And you want to wear your mask as well. So again, whether they've traveled or not, assume that anybody that you encounter may have COVID.
You know, Suresh, I think it's important that people recognize that risk and safety are not like a light switch where you turn it on and you're unsafe, or you have high risk and you turn it off and you have no risk, or you're completely safe. You know, with this virus, it's a spectrum, and sometimes you can't assess that risk. So you need to be protective all the time.
Correct. And perhaps this question has to do, again, with Thanksgiving, and sometimes you cannot scare your in-laws and they still show up. But I mean, the safest recommendation would be to, if you want really to maximize safety, would be for both groups to quarantine 14 days before travel. If you were not able to do that, even if your in-laws did it, but you were not able to do so, you continued going to work, etc., or you socialized, you may have COVID. You may give it to them. So wear a mask when you're around them.
Jorge's just trying to give you a better way to keep your in-laws away. Let's see here. Let's do some worthy shout-outs before we run out of time. A huge shout-out to my sister and all of her colleagues working in the infectious disease department. We really appreciate all you are doing to get a vaccine ready in a very shortened time. You truly are healthcare heroes. Absolutely, they are. We're really blessed here at the University of Iowa to have such an amazing infectious disease division with such an illustrious group of people. How are the social workers helping the UIHC get through this pandemic? I don't have enough time to list all the ways, but I would say that they're providing such necessary support for so many of our patients that are having challenges both getting into the hospital and out of the hospital, and all throughout the process having the support that they need to get the treatment that they have. So absolutely, our social workers have been amazing throughout this whole thing. Do a few. Will the shout-outs at the beginning be played again at the end of this event? Someone in charge is telling me yes. Let's see here. We understand that it'll take some months for everyone to have access to the vaccine. Do you have a sense of how long we have to go for rigorous wearing of PPE? A while. A long while. Terry, are the COVID antibodies from plasma still being used in treatment? How does one go about donating to the cause?
They are. We are still using convalescent plasma. They are actually looking at the donations and looking at which people tend to make more neutralizing antibodies and are using those preferentially. If you want to donate, you must have had COVID, and you can give a call to our main number, and they can direct you to the pathology area where you can sign up to donate. thanks for considering it. Really important that we all stick together, and that's just one way that you can do it if you've had COVID-19.
Jorge, one last shot at the in-laws. Please comment on the extent to which we are at risk by flying commercially.
There is some risk, especially in the waiting areas in airports. Fortunately, airplanes, even though we're very tightly close to other people, airplanes have a number of engineering controls to ensure that there are a good number of air exchanges, that you're not breathing the same air. There are now, every airline mandates that you wear a mask. So I think that a short domestic flight is probably safe, but you have to be careful about the waiting areas, for example, in the airport. Of course, it would be safer if you stay at home, but domestic flights are relatively safe.
So Jorge said it'd be safer if your in-laws stayed at home. The final piece of this is the huge shout out to all of you in hospital leadership. Your calm demeanor, transparency, and guidance through all of this is appreciated. Thank you, but really, this has been a complete team effort, and it's actually been quite humbling for all of us, for Terry, for Jorge, for myself, to be in leadership positions at an organization as amazing as UI Healthcare with so many amazing staff. And I can't emphasize enough how all of us are in this together. Every single UI Healthcare team member has a role to play in this, whether you're directly in patient care, whether you are supporting us in the academic mission, in the research mission, or in patient care, whether you're in support services or you're the head of infectious diseases. All of us have a role to play, and we're really lucky to have one another. All the best to you during this holiday season. Thank you for tuning in. Have a good evening.
Stay safe.